examples of synovial joints. And these are going to be very complex joints. They're freely movable, large compared to many of the joints in the body. And they would be the shoulder, the elbow, the hip, and the knee. So the shoulder joint is a ball and socket joint. The head of the humerus fits into the glenoid cavity of the scapula. It's has a loose joint capsule. There are ligaments that help prevent displacement. There's also a structure called the glenoid labrum that helps hold it in place. There are several bursae, which are little bags of synovial fluid that help lubricate where there are tendons. It has a very wide range of movement, which includes rotation and circumduction. And the trade-off for that wide range of motion is the stability of the joint. Some of the major ligaments of the shoulder joint include the coracohumeral ligament from the coracoid process to the humerus, the glenohumeral ligament from the glenoid cavity to the humerus, and the transverse humeral ligament. The elbow joint contains two articulations within it, a hinge joint between the trochlea of the humerus and the trochlear notch of the ulna, which is involved in flexion and extension only. But it also has a plane joint or gliding joint between the capitulum of the humerus and the fovea of the head of the radius, and this joint allows for pronation and supination. There are several important reinforcing ligaments in it. The major ligaments of the elbow joint would include the radial collateral ligament, the ulna collateral ligament, and the annular ligament. In the hip joint, we also have a ball and socket joint, but the head of the femur fits much deeper into the acetabulum of the hip bone. We have acetabular labrum that make that connection even stronger. There's a heavy joint capsule, and there are lots of reinforcing ligaments. We get a variety of movement out of the hip joint, but much less than we would get out of the shoulder joint. The trade-off again is for stability. Major ligaments of the hip joint include the iliofemoral ligament, which is the strongest ligament in the body, going from the ilius to the femur, the pubofemoral ligament, going from the pubis to the femur, and the ischiofemoral ligament, going from the ischial process to the femur. Replacing joints has become more and more popular and works much better than it used to in the old days. We can use synthetic materials to replace joints that are damaged by arthritis or injury. Steel and titanium replace the larger joints. We can use silicone for smaller joints, ceramic in some cases. Hip replacements are the most common. There's new technology for joint replacement is to use materials that resemble the natural body's chemicals, such as coating an implant with something like hydroxyapatite. And it may be, in the future, will be 3D printing custom joint replacement joints so they fit more accurately. The knee joint is the largest and most complex joint of the body. It's actually a combination of joints. There are three bones that take part in the knee joint, the femur and the tibia from the leg, and then that sesamoid bone, the patella, in the tendon in front of the femur and the tibia. So the femur is the medial lateral condyles of the distant end, while the tibia uses the medial and lateral condyles of the proximal end. The patella articulates with the anterior surface of the femur. It's strengthened by many ligaments and tendons and cushioned by bursae and fat pads. There are a number of menisci in there that separate the femur and the tibia from each other. The major ligaments of the knee joint are the patella ligament, the oblique popliteal, the accurate popliteal, the tibial or medial collateral ligament, and the fibular or lateral collateral ligament, and the anterior cruciate ligament and its partner, the posterior cruciate ligament. The knee joint is a modified hinge joint between the condyles, which involved flexion and extension. There's also some rotation when the knee is flexed, and there's a plane joint between the femur and the patella. So joint disorders would include sprains, which is a tearing of connective tissue in the joint without dislocating the bone. Bursitis would be inflammation of the bursa from overuse or other stress, inflammation. Arthritis is an inflammatory swelling and pain at the joint. Rheumatoid arthritis is an autoimmune disease. There are antibodies and T cells that attack arthritic joints. Rheumatoid arthritis is also a systemic disease. We think about it most in the joints, but it does have effects elsewhere. Osteoarthritis is the most common. It's a degenerative arthritis. It's thought to be just a normal accompaniment of age. With osteoarthritis, the more you use the joint, the less it hurts. With rheumatoid arthritis, the more you use it, the more it hurts. Arthritis can also be caused by a bacteria passed through a tick bite. That's called Lyme disease. Over the course of our lifetime, our joints stiffness is one of the first things we see in aging. A lot of people develop arthritis in one form or another. That's really a collection of a number of different diseases as they get older. Fibrous joints are the first to change. They can strengthen, however, over a lifetime. Cartilage in the synchondrosis stiffens. Ligaments will lose their elasticity. There'll be changes in the symphysis joints of the vertebral column. That diminishes flexibility and does decrease height. We do shrink as we grow old. Synovial joints lose function. Capillary supply diminishes. If we don't use them, we don't get as much nutrients to them, and that can speed up the stiffening process. So activity and exercise are very important to keep your joints functional for a very long time. This slide and the next slide, I'll just review them. Moving a part away from the midline of the body is abduction. Moving toward the midline of the body is adduction. Decreasing the angle between two parts of a joint is flexion. Increasing the angle between two parts of a joint is extension. Movement at the ankle that decreases the angle between the foot and the shin is called dorsiflexion. Movement at the ankle that increases the angle between the foot and the shin is plantar flexion. When a part moves on its axis, it is rotating. Circumduction is moving a part in a circular motion. Turning the palm upward by rotating the forearm is supination, and turning the palm downward by rotating the forearm is pronation. With that, no, not with that. Moving the sole of the foot to a lateral facing is eversion. Moving the sole of the foot to a medial facing is inversion. Forward movement is part of protraction. Backward movement is part of protraction. Lifting a part upward is elevation. Moving a part downward is depression. And with that, I will stop it. And that ends chapter 8.